We're here to help you separate fact from fiction about the COVID-19 outbreak. We've been sorting through hundreds of your questions every day. And today there are questions about hydroxychloroquine and the treatment for COVID-19, plus what to do if you're still getting charged for a gym membership. KOMO's Tammy Mutasa is live in the newsroom with answers about those things. Tammy?
Eric, a lot of people want to know if they get protection from drugs they're already taking. As for gyms, a lot of people don't want to get charged for a service they're not getting, and the Attorney General is listening. I take hydroxychloroquine daily for rheumatoid arthritis. What can I expect, if anything, if I should get coronavirus? The topic about different therapies came up at a recent COVID-19 Q&A with Fred Hutch infectious diseases doctor Joshua Schiffer.
And unfortunately, all of the studies to date have not been controlled. And so there has been a lot of positive and negative information flowing back and forth about this drug.
Recent early data compiled by the Global Rheumatology Alliance show that dozens of people taking hydroxychloroquine and other treatments for chronic rheumatologic diseases have become infected with COVID-19. Experts say more data is needed.
Nationally and a bit globally, you can see that we were caught unprepared here, because now there are 15 studies studying hydroxychloroquine, which is way too many.
Another concern out there is what to do if you're still being charged for a gym membership, even though gyms have been closed. After getting dozens of complaints, Washington Attorney General Bob Ferguson sent this open letter to fitnesses and gyms across the state, warning that businesses must let customers cancel their memberships for any reason. Here's the guidance. Customers can cancel their memberships at any time, as long as it's in writing. Members who cancel are legally entitled to a refund, not just credits. Fitness centers must pay the refund within 30 days. Gyms and fitness centers cannot prevent members from canceling.
COVID-19 antibody testing is coming to Washington State on Tuesday.
We're going to go live tomorrow morning.
Alex Greninger, Assistant Director of the University of Washington Clinical Virology Lab, said by the end of the week they could run up to 7,000 tests per day, all to track who was infected with COVID-19.
Fundamentally, it's about understanding who's been infected, how many cases did we miss or did we just not test for, those sort of epidemiological questions, and then what's the risk look like going forward. Those are the main questions this test can help answer.
We've seen earlier efforts of antibody testing across the country in California and in New York with finger prick tests. Greninger said criticism for early tests, questioning their oversight and accuracy, is fair.
There was an article in the New York Times and the Washington Post both yesterday on how the antibody tests were bad. And, that I think that story should have been published like a week ago or 10 days ago, because that was absolutely the truth. Before some of these tests became available.
For improved accuracy, Washington's test will rely solely on blood drawn from your arm at participating physicians' offices and sent to UW Labs, where they hope to have results with expected 99.7% accuracy within 24 hours.
We're well set up for it. We're well integrated. We are a reference lab for all sorts of labs around the state and around the Puget Sound area, so we'll be able to handle it.
The state of Washington says labs across the state now have capacity to process 22,000 tests a day, but lack of supplies are only allowing 4,500 people to be tested daily. However, more supplies will soon change those numbers.
Some will arrive today. My understanding is it'll be over the next week or two.
Dr. Charissa Fortinos, Deputy Chief Medical Officer at the Washington State Healthcare Authority, is talking about supplies to assemble 750,000 COVID-19 test kits that are expected to increase testing.
I do feel like we're making progress. I wish it were like a switch that we could just turn it on and say we've tripled our capacity.
But the national demand for these supplies has made that impossible. But today, another potential supply issue.
One of the limiting factors that we're hearing about now is the labs themselves are having shortages of the reagent, and that's what they use to run the tests.
The state has sent out a survey to labs to better understand the scope of this possible problem that could slow down testing. This all comes after UW-Medicine asked the state to recall thousands of test kits they went extraordinary lengths to bring stateside. The State Department of Health recalled 12,000 tests because the liquid in the testing vials was off color.
And the VTM tubes do not come in contact with the patient. So we believe that the source of contamination we find poses no risk to the health of the patients.
The state says tonight they have enough kits to replace the recalled tests without any impacts to long-term testing.
Restarting production of commercial airplanes in the Seattle area. That puts 27,000 people back to work after the operations were halted because of the coronavirus. KOMO's Michelle Esteban reports right now managers are back and new safety procedures are in place. But Michelle, the question tonight, how are the workers feeling about all of this?
Well, good question indeed. And it really does depend on who you talk to. Some are really anxious to get back to work, but others are confused because that stay home, stay healthy order in our state is in effect until early May. In fact, one mechanic that I talked to today, he said he'd rather be safe and wait until then.
Pretty anxious, not looking forward to it. I don't think the measures they've taken are going to be enough.
He's concealing his identity to protect his job, but this mechanic admits he won't know if Boeing's done enough until he returns to work Tuesday here at Boeing's Payne Field. 27,000 workers working staggered shifts will be phased in over the next several days, starting late tonight.
There's been a few people that didn't want to go back to work, and it's understandable.
Union leadership sent reps inside each plant today to review Boeing's new safety protocols now in place. They say if a worker believes they're in imminent danger, they can pull a red card, immediately stop working. Boeing wouldn't comment on camera, but in emails told me it has taken extra safety precautions to keep people safe and prevent the spread of COVID-19. They include staggered shift times, spread out work areas, mask required, wellness checks at the start of each shift, including voluntary temperature screenings. Workers are strongly encouraged to bring their own masks or face coverings.
If they want to operate, then yeah, they should be providing the mask and not asking people to bring them from home.
Boeing says it'll provide masks for those who don't have one or in areas where physical distancing can't be maintained for an extended period. Aviation analyst Scott Hamilton said it's not just safety at Boeing, but their suppliers too.
But you have all these suppliers who have their own virus challenges. We just don't know how that's going to work out.
Now, Boeing told me they are definitely seeing some impact from suppliers, but they told me, quote, that we have a robust risk mitigation plan. As for that enhanced safety plan, I called the state to find out what they think about it because the governor talked about that last week. Well, it turns out labor and industry actually reviewed the plan. Actually, Boeing even took it to them and asked them to look at it. They gave them a thumbs up. They said that it's acceptable. So hopefully that's reassuring for all those 27,000 employees heading back to work.